Anauran is a combined preparation for topical application. It has an antibacterial and local anesthetic effect. Indications: acute and chronic otitis externa, acute otitis media at the stage before perforation, chronic exudative otitis media, postoperative purulent complications after radical mastoidectomy, tympinoplasty, anthrotomy, fenestration. How to take, course of administration and dosage. Anauran is instilled into the external auditory canal with a special pipette and kept there as long as possible. The patient keeps his head tilted to one side for several minutes. Adults 4 to 5 drops 2 to 4 times a day. Children 2 to 3 drops 3 to 4 times a day, depending on the severity of the disease. Contraindications: hypersensitivity, special instructions. Anauran is used exclusively for ear diseases. In severe and persistent infections, topical treatment should be supplemented with systemic antibiotics. Prolonged use of Anauran as well as other antibiotics can lead to the development of superinfection with drug-resistant microorganisms. Side effects: possible local allergic reactions that disappear without treatment after the cancellation of Anauran, hyperemia, itching and peeling of the skin of the external auditory canal. Systemic effects are unlikely due to the low doses of the drug used. However, with long-term treatment with Anauran, systemic effects may occur, in particular ototoxicity and nephrotoxicity due to the absorption of Neomycin.